Now, with magnesium, it's important to note that it's not included in the standard metabolic panel or the standard comprehensive metabolic panel, but it's an essential mineral for over 300 biochemical reactions. And about half is stored in the bone, while the rest is inside of cells. Only about 1% circulates in the blood, but the body works hard to keep that level very stable. Magnesium regulates blood sugar, blood pressure, protein synthesis, energy metabolism. What doesn't it do? It also plays a vital role in muscle and nerve function, heart rhythm, and bone strength. Magnesium is absorbed mainly in the small intestine, though some absorption occurs in the large intestine. The lower the body's magnesium status, the more efficiently absorption occurs. Excretion happens primarily via the kidneys, and because renal exertion can vary widely, the magnesium balance depends on both intake and kidney function. This makes magnesium deficiency common in malabsorption conditions, alcoholism, or even renal disease. There are several ways to assess magnesium, but each has its limitations. Serum magnesium is the most common, yet it doesn't reflect total body stores. Red blood cell magnesium and urinary excretion can provide additional information. The magnesium retention test, which evaluates how much magnesium is retained after a load, is more sensitive but less commonly used. Normal serum magnesium levels that we would measure are between 1.8 and 3.0 milligrams per deciliter. Now, some hypomagnesemia causes of low magnesium in the blood could be due to decreased dietary intake, malnutrition, or GI loss, chronic diarrhea, for instance. Renal losses may be congenital or drug related or drug induced, and endocrine disorders such as hypo or hyperaldosteronism, even diabetes mellitus can also play a role. Other causes include chronic alcoholism, stress, prolonged exercise, or severe burns. Because magnesium is involved in neuromuscular stability, low levels can mimic or worsen potassium and calcium abnormalities. Symptoms of hypomagnesemia include neuromuscular irritability. Patients could have tremors, tetany, or muscle spasms. It also predisposes patients to cardiac dysrhythmias, elevated blood pressure, because magnesium and potassium work closely together. Hypomagnesemia can be mistaken for hypokalemia, and in fact, the two can occur simultaneously. Recognizing low magnesium is important because correcting potassium without fixing magnesium may be ineffective. So these are some of the symptoms again that I mentioned: tremors, confusion, hallucinations, even seizures. Clinically, you could see hyperactive reflexes and some of those same signs that we saw before with our potassium, as well as neuromuscular hyperexcitability. Severe deficiency could lead to arrhythmias, hypotension, impaired memory. And because these signs overlap with calcium and potassium disorders, magnesium testing is really important in unexplained cases of neuromuscular and cardiovascular dysfunction. Now, hypermagnesemia is far less common and typically in the setting of renal failure or if there was excessive magnesium intake from supplements or laxatives. High magnesium will depress the neuromuscular junction, causing lethargy, decreased reflexes, and muscle weakness, and in severe cases could lead to hypotension, bradycardia, and even cardiac arrest. So this is why there is a caution when giving magnesium-containing medications or supplements, especially to patients with kidney impairment. So some symptoms to watch for this would be drowsiness, warmth, or muscle weakness. On exam, reflexes could be hypoactive, respirations depressed, and in extreme cases, we could see cardiovascular collapse. While magnesium normally has a calming effect, too much essentially turns off neuromuscular excitability. This is why close monitoring is really essential in high-risk patients.